So Blessing CEO has released her CT scan results. Let's take a look at it together. This is a very important topic because breast cancer is the most common cancer in women globally, that is worldwide. It is the most common cause of cancer deaths in women globally, worldwide. So it's very important we correct misinformation and people understand and are aware about breast cancer and how it's diagnosed. Hmm? First thing I noticed was the doctor that reported this clearly stated is there her clinical summary, that is her medical history, was not provided. I'll explain. So usually when we request an imaging, that is CT, MRI, ultrasound, we always include a brief clinical summary, the reason why you're requesting the scan, the patient's symptoms, your suspected diagnosis, etc. Do you understand? Don't forget that the person that is going to read the CT scan and report the CT scan is a doctor. So that doctor needs to have a fair picture of what's going on with the patient. So we always include a clinical history. So they need the clinical context to help support their interpretation so that they can interpret properly. So when the doctor says no clinical summary was attached, it simply means that her clinical information history was not sent or the information was insufficient. And by the way, doctors will always give a clinical summary to the radiologist. So I find it quite interesting that a doctor will not attach the clinical history of a patient that is going for cancer staging. By the way, for you to go for cancer staging, that means you have been diagnosed of cancer. You're going for staging so that the doctors can know the extent of the spread. For someone that claims she was diagnosed of cancer, it's quite interesting. That's what I'm saying. Now let's move over to the findings of the CT scan. I'm going to simplify it because there's a lot of medical words there, but I'll just simplify it. It says liver normal, spleen normal, the bowels are unremarkable, meaning that they didn't see anything to raise alarm, anything alarming, any abnormality. So it's unremarkable. It says the bones, no destructive lesions seen, because in many cancers, spread to the bones will cause destructive changes seen in the bones. The pelvic lymph nodes are remarkable too, meaning they didn't see any significant thing, they didn't nothing to suspect spread to the lymph nodes. Now, this is the abdominal region, that is the belly area, this scan. So, belly area, no spread there, basically. Now, let's move over to the chest. The chest area, the lungs, normal, the mediastinum, unremarkable. That means they didn't see any abnormal change there. Now, the breast, it says focal subcutaneous fat, blah, 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 all medical words. But if you read further, it says no discrete mass seen. What this means in simple English is, yes, they saw some abnormalities here and there that could raise suspicion, but they didn't see discrete lump, any discrete lump. That's what they mean by mass in her breast. The lymph nodes under her armpits describe changes, but non-cancerous changes. So according to the CT she posted, the report is basically saying there is no metastasis, there is no distant spread of cancer. That automatically cancels the stage 4 cancer. Now, I want to assume that her saying stage 4, maybe a misinformation, misuse. No, she has no clinical knowledge. She's not a medical doctor, she has no clinical knowledge. So it could be a misuse of language, no problem. Now, before a doctor will send you for CT scan to stage the cancer, the doctor must have done, regarding breast cancer, the doctor must have done an ultrasound or a mammogram, depending on her age. Ultrasound for younger ladies, mammogram for older ladies. After that, the mammogram and ultrasound say, oh, there's a lump here. Oh. Now, we will now do a biopsy using a needle to take a sample of the lump and then we send to the pathologist. The pathologist will check under the microscope. Oh, no, the cells here are not cancerous. Or, oh, the cells here are cancerous. And send it back to the doctor. Then we can say, oh, this patient has cancer. The next thing is to stage to know the extent of spread using a CT scan. No, so if she claims she has cancer, she could not show us her biopsy results that says, oh, she has cancer. CT scan does not diagnose cancer. People have lost mothers, sisters, aunties to breast cancer. It's quite sensitive. Let's be guided. Now you know.